am Dr. Tapit Ahmed from the Department of Cardiology, Baptist Hospital. On this special day of World Hypertension Day on 17th of May, I would like to give a special message to all my friends over here. So hypertension is a very common disease that is affecting all the age groups that we see of patients coming to us, even among young and middle-aged adults. According to the recently concluded National Family Health Survey, there are about 21 to 24% of adult females and males have hypertension. And we can hardly imagine how many of them are actually seeking medical attention and treatment. So the problem here is we tend to ignore our normal, regular, minimal symptoms that come with hypertension, including minor headaches, minor blurring of vision, or sometimes we get a little more irritable, we get a little breathless or tired in our day-to-day routine, or fatigue by the end of the day, especially at the top of the head, some kind of a headache, or back of the head, or some mild visual fatigue, or training, to feel drained by the time of the end of the work of your daily routine. So these are all important things which we actually tend to ignore. We feel it's because we have been very busy, or we are having a very busy lifestyle or a schedule, and then we don't get ourselves checked. And it should not come to the point that we come with an emergency or a crisis to the emergency room in a hospital. So such things, such simple symptoms or headaches or dizziness or blurring of vision, mild blurring of vision also, or breathlessness and fatigue, please seek medical attention. If you have a BP apparatus belonging to either of your some senior citizens or any BP digital machine at home, check your pressures. So the theme of this hypertension day is be accurate in your recording of your BP and control the blood pressure and live longer. So monitoring and measurement of the blood pressure is extremely important. Now, unrecognized, undiagnosed hypertension would lead to a lot of end organ damage and target organ damages, including the heart, kidney, brain, and eyes. This is a very important disease subset which is commonly ignored. So what we see is just about 5 to 8% of hypertension patients are actually being adequately treated. So let's not ignore common symptoms that we come across in our day-to-day life. Let's not ignore the complaints of our colleagues and friends who we live with or who we work with who have such similar common symptoms, and ask them to seek medical attention as early as possible. Take some necessary steps in treatment, and lifestyle modification is extremely important as well. Taking medical treatment, all of us will be thinking that it's a lifelong kind of a therapy. That's not important. The more important aspect over here is undiagnosed, uncontrolled, long-term hypertension affecting our day-to-day life and having target organ damages that we see in later stages of hypertension. So please don't ignore simple symptoms. Come and seek medical attention and take the necessary care, including pharmaceutical agents and lifestyle modifications. Thank you.